We're going to discuss the treatment of a severe Cavovarus deformity after a bad car accident / trauma. Please follow us at Ankleman on Instagram, and at YouTube we now have a new channel, Orthopedic Foot and Ankle Surgeons. So what is a cavus foot? Well, that is where your foot becomes very rigid in the shape of a higher arch and tilts in more towards the center of your body, as shown in this patient here. Makes it very difficult to walk, a lot of pain, discomfort. In this particular case that I'm going to show, the patient had a bad car accident, had an ankle fracture, dislocated the joint below, and had a lot of soft tissue injury and femur fracture. Now, 6 months out, came to us with this deformity. As you can imagine, if this was your foot or ankle, it's very hard to walk. It's very painful because of the ankle arthritis, the shape of the foot, and so they want to know what could be done besides an amputation to try to get this person back to walking again without a lot of pain. You can see here we got a preoperative CT scan, and this allows us to really understand the 3D deformity. In this case, the talus bone is very white and hard and not healthy. The joints are dislocated, and the navicular is now stuck on the talar head. You can actually see the CC joint is adducted and deformed. This is a rigid deformity that with a dead talus that has no blood flow and an abnormal fusion between the talus and the navicular, so it makes it very thin stuck. On the sagittal or side shot CT, you can see there's a ton of arthritis and non-union of the medial malfracture. And the question is, what can be done to help this problem? Wants to walk without pain. We want to set real expectations. And although you could do a quote-unquote total talus, he does not want to risk revision surgeries. So this is an intraoperative fluoroscopy, and I'm going to let it go through here. You can see we did a bone block TTC. I resected the entire talus, left a gap where the talar head was, and that allowed this to heal. I utilized biologic augmentation with bone marrow with the Angel BMC, and then I used also the BMP and a femoral head to reconstruct the entire defect. And this really allows us to get a nice neutral position of the hindfoot, maintain the height so he's not short compared to the other side, and give him a pretty functional limb. You can see now 2 years after the surgery, he's got a solid fusion, the pseudo-articulation. I had to correct the toes later with some Arthrex headless screws, but he's got a neutrally aligned foot, no infection. The chance of needing revision surgery now is much, much less than such as a total talus, which could have been done, but this patient didn't want to have that with his prior multiple flaps. Walks in a gym shoe, minimal to no pain. No one's ever pain-free, but you're so much better that these patients are just in general happy and do well. So it's always a salvage. I do believe in getting CAT scans to verify. You can see here on the CAT scan after a year the femoral head is totally integrated. No issues, no evidence of failure. On the side shot you can see total integration of the femoral head. And taking out that talar head and neck allowed reduction of deformity and allowed some motion so it's rigid. Thank you for watching. Follow us at @Ankleman, Orthopedic Foot and Ankle Surgeons on YouTube, and then our surgical website is chicagoanklesurgery.com. Thank you very much.